As we've been reporting, hospitals are overwhelmed with COVID patients, but monoclonal antibody therapy might be a solution. We keep hearing more and more about this term, but what exactly is that treatment? We're digging in with medical experts, Dr. Carla and Rob Robinson. They're our kind of go-tos here. We appreciate them. Dr. Carla, a board-certified family physician. Dr. Rob, a board-certified internal medicine and hospitalist physician. Doctors, first of all, thanks for being here. We appreciate it.
Thanks for having us.
Absolutely.
So let's start by talking about this monoclonal antibody therapy. Why are we just starting to hear about this? Is it something new, and who should get that treatment?
Actually, it's not new. We actually use monoclonal antibody therapy for a whole host of conditions, usually autoimmune diseases, cancers, many immune modulated conditions. And so the therapy itself is not new. However, it has recently gained popularity, so to speak, as it relates to treatment and or prevention of COVID-19 infection. And so, it really is an exciting time in medicine because we do know that this is another option for those who may have been exposed to COVID-19.
So if I think I've been exposed or if I test positive for COVID, is there a window of treatment and can anybody get this? And who should they ask?
Yeah, that's a great question because there absolutely is a window of treatment. And so first and foremost, that window is ideally within 4 to 5 days of symptom onset, but certainly no greater than 10 days. And so if you recognize that you have symptoms of COVID-19 and then subsequently test positive, then it has to be within that 10-day window, again, ideally 4 to 5 day window that you receive this monoclonal antibody therapy. Now, as it relates to who is eligible to receive this type of therapy, children over the age of 12 and all adults who test positive for COVID-19 are eligible for this therapy, assuming they meet other criteria, specifically being high risk for hospitalization or severe complications. And so those are individuals with heart disease, lung disease, chronic kidney disease, individuals who might otherwise be on medicines that suppress their immune system. So it's most important, if you test positive, if you know you've been exposed, to speak with your clinician, see if in fact you're eligible, and get further guidance from your primary care provider to determine if you're eligible, and if so, then to be directed to a site where you can receive this therapy.
Okay, so what exactly does it do? What is it?
So it's basically very much like our own antibodies that we make in response to infection. It's just created in a lab, but it really works in the same fashion in where it attaches to the COVID-19 virus and prevents it from entering the cells in the body and prevents it from spreading. And so it really does kind of mimic what the body should do in mounting a response when exposed to it. So it really is effective, very similar to receiving a vaccine in the sense that the vaccine boosts your own body's immunity. This is just a synthetic immunity that's created to boost your immunity should you have been exposed to COVID-19.
Well, this is a term we're going to be hearing more about in the coming weeks and months. You know, in the general population, you guys are doctors, so you knew about this, but this is something that's really just starting to make the rounds. A lot of people on social media talking about it. So thanks for the explanations. I think that, our viewers, again, well served by that kind of information.
Our pleasure.
Thanks.
All right. Good to see you guys. Thank you again.